I take 2 medications a day. That's all I take, but I have friends who take more medications than that. And what I've heard from those friends, that Network Health is the best place to be a member because of pharmacy and because of prescription service. So guess who I have today? This is Andy. Hey, Andy. How are you? Good to see you.
Good to
see
see
you're
you.
a pharmacist with Network Health.
I am.
And you came down to have a
Visit
visit.
you.
It's
Yeah.
so good.
Thanks for having me.
Oh, sure. What do you offer me as a Medicare member with Network Health, and how do I depend on you?
We have a team of clinical pharmacists that work on the MTM, or Medication Therapy Management Program.
Okay.
And for our Medicare members, you qualify based on the drug spend, the number of medications, the maintenance medications or chronic medications, and the actual chronic conditions that you have.
Yeah.
They call or we call out to them. So we have a list of everybody that qualifies. You have the opportunity to talk with one of our clinical pharmacists, which is about a 10 to 15 minute conversation. We're going to go over all your medications, both prescription drugs, vitamins, over-the-counters.
Like, tell me if this all works together, right?
Right, yeah. So we also know that some of the medications can have interactions with some of the foods we eat or the vitamins that we're taking. So we want to make sure that we're covering everything during these conversations. So even if you don't qualify, and I'll use air quotes there, but if you don't qualify, you still have the opportunity to call us. And we really want you to call us if you have any questions. I think we're one of the only plans that publicize or publish our pharmacist phone number and the email address. So in the middle of the night, if you have a question that you come up that pops in your head and you're like, I need to call Andy or email Andy, you can do that.
And you'll answer.
And we'll answer.
That's how it works.
Yeah. And then we say, we understand that, pharmacy can be confusing. We want to make sure that you're taking your medications properly. There's no questions on costs.
Yeah.
That's probably the biggest thing we focus on.
And how do you help them with costs?
Yeah, so let me give you an example.
Yeah.
So we have a member that's on an expensive inhaler for COPD or asthma, right? Some of these can run $450, $500 per month.
Oh, wow.
Right? So we have alternatives that are less expensive. So these can be anywhere from $100 to, say $100, $200. So much cheaper, and over the cost of a year, that
Huge
can add
saving.
up, right?
So you have classifications of drugs, 1 through 5?
Yeah, so every Medicare plan has a formulary, and on that formulary is how the drugs are tiered, and that's how we assign your copays. So tier 1 and 2 are generally generics. Tiers 3 and 4 are going to be brands. And then specialty is tier 5, and those are like your highest cost medications.
I need a flu shot? I can depend on you guys to give me that.
You bet. So
Yeah.
one of the big things we do with our Medicare population each fall is we offer them a flu shot event.
Yeah.
We say flu shot event, but it's actually a vaccination event, right? So you have
like
the
a party,
opportunity,
kind of,
right?
isn't
So throughout Northeast and Southeast Wisconsin, and this year is no different. In the past 2 years, we've done a drive-through clinic, so you don't even have to get out of your car,
really?
right? Just drive in and we'll get you your
You're done.
vaccination. So we primarily focus on flu, so the influenza vaccine. But if we find that you have a gap in care, or gap in your vaccination status, we'll actually do a pneumonia shot or a shingles vaccine. And we partner with local Walgreens and Walmart pharmacies to provide these vaccine clinics.
So to join, to get into Medicare was like, this is the best thing ever. I am so happy. I'm 65 years old. And drug program wise, and my prescriptions now cost me, it's $5 to refill. That's every 3 months they refill my prescription, so it's $15.
Amazing, right?
No, it's amazing.
Keep up the good work.
It's really amazing.
Yeah.
Yeah, I'm telling you, once I joined and became a member, I'm so thrilled and honored to be part of this.
Yeah, it's fantastic. I mean, our benefits are second to none.
Yeah.
Our member experience and customer service is unbelievable, and I'm just really proud of the work that we've done so far.
Thanks for coming down. This is Andy, I'm John. This is talking about the Network Health neighborhood. Thanks.
Thank you.
See ya.